that I've just decided to read out. It's from the 30th of August 2023, the UK government website, and the title is The NHS Vaccination Response to the Urgent BA 2.86 Risk and Changes to the Autumn-Winter 23-24 Vaccination Delivery Programme. I was debating reading this out last week, but at this stage in the game I'm not here to change people's minds. I think people who are going to be going along with these offerings are fully committed to the scandal that has been playing out for the last 3.5 years. However, for people who aren't going along with it for whatever reason, but they maybe still have trust that these jabs are all for people's benefit, I just would like you to listen to the wording and see if you find any of it as ominous as I do. It's a 4-page document. I'm not reading all of it. I've just got a few snippets highlighted. Yeah, I just want to read what I've found out. So it's talking about this vaccination rollout. So it's the new COVID jabs. But as you'll find out, they're not new. So it says, while it is difficult, which I would actually word impossible, but they say while it is difficult to predict the combined effect of the large number of mutations on severity, vaccine escape and transmissibility, expert advice is clear that this represents the most concerning new variant since Omicron first emerged. The UK HSA has determined the most appropriate intervention with the greatest potential public health impact is to vaccinate all those eligible quickly. Now the wording, I've checked through the document. If I've misread, please feel free to correct me, but I couldn't find any mention of consent anywhere in this document. Following this advice, the Secretary of State for Health and Social Care has asked NHS England to bring the vaccination programme forward. So it's due to start either later on this month or in October, but today is the day these jabs will be starting. So the timings. For operational expediency and in line with public health recommendations, wherever possible, flu and COVID-19 vaccines should be administered at the same time. So two jabs on one day in one session is obviously a higher risk of mix-ups happening. Some people may be wanting flu jab but not the COVID jab. Getting an accidental jab, getting a double dose, let me just assure you, I know mistakes happen. I know. And once they've been made, they can't be undone. So from 11th of September 2023, systems must start vaccination for care home residents and those who are housebound. Why does it say systems? I don't understand. Why are they removing any reference to, doctors, surgeries, nurses, people? It just talks about systems must start vaccination for care home residents and those who are housebound. So basically, the most vulnerable people, vulnerable for me, not to the thing they're being jabbed against, vulnerable in the fact that many people have dementia, Alzheimer's, confusion, forgetfulness, feel the pressure of living in care homes, feel the pressure told to them by healthcare professionals about you must look out for other people. So I know, again, personal experience, that people are told this. They're pressured into having jabs that they've not previously wanted through now living in a care home. This is disgusting. So it says, we are asking systems to ensure that all residents are vaccinated before the 22nd of October 2023. I really don't like that word, ensure. I find it quite an ominous word. Further down the document, there is no change to flu vaccination for children. It is essential that this begins early in September, as previously communicated. Essential. Essential in whose eyes? Certainly not mine. Remember, the flu jabs are coming into secondary schools in England. Whether it's the rest of the UK, I'm not sure, but in England this year for the first time. Remember when children could just be ill with winter colds and things in the past? Remember when there weren't campaigns to promote vaccines? Financial support. Commission providers will now be eligible to claim an additional acceleration payment of £10, which is in addition to the IOS fee, and the IOS fee stands for the Item of Service fee, for each COVID-19 vaccination administered to care home residents between Monday the 11th of September and Saturday the 22nd of October 2023 inclusive. So an additional payment of £10 because they've brought the rollout in early, plus the IOS fee already, which is around about the £10 mark. So we're looking at approximately £20 per resident for the COVID jab. We'll be looking at an amount for the flu jab, but even average it out to £20 per resident. Say there's a care home with 40 members of the 40 residents in there who all go ahead with this double offering. That's £800, easy money. And then it continues. A separate one-off additional payment of £200 for each completed care home by the 22nd of October that is confirmed to the Commissioner. So an extra £200 for each completed care home. It doesn't actually say, is that completed care home as in all residents, or completed care home in all residents who choose to have this offering or these offerings. It doesn't confirm what that's for. If it is for the entire cohort of residents to be jabs, just imagine that pressure going up. Let's see how many people we can get done. It's money being rewarded. The more people you jab, you watch your money coming in. It's a money game, isn't it? It's a money game, big pharma, for the people who are in it at the top and the companies making all the products. Access and equity. Systems, there's that word again, must maintain their focus on ensuring that no one gets left behind. Ensuring no one gets left behind. Again, no mention of consent at all. Systems are encouraged to think creatively about how they continue to use the fund to support an improved and equitable uptake across their communities. Mobile clinics and pop-ups such as roving buses, temporary clinics at supermarkets, shopping centres, places of worship and events